16 years at ISCM, Dr. Meena and I have been consulting more than 165,000 patients for yoga therapy. Whenever you ask the person, Vanakkam, who are you? Every time I'm very wrong. Sir, I am diabetic, sir. Sir, I am back pain patient, sir. Sir, I am cancer stage 3 patient, sir. Your disease has become your identity. So first of all, your disease has become your identity. Second thing, my diabetes, sir. My hypertension, it has become your property. Now we know in India, right from the days of Mahabharata, the whole fight was over property. Tamil Nadu Patanjali Sanda சொல்லுவாங்க. எல்லாமே சொல்லுதுடா. சோத்துக்கும் சொத்துக்குள்ள சண்டை இல்லை. ஒண்ணுமே சண்டை இல்லை. What is happening is that we have stopped identifying as who we are and we have identified with the disease. Because we have identified with the disease, we are afraid to lose the disease. Because if your diabetes gets cured, you don't know who you are. Because you have identified as a diabetic. If you lose your hypertension, you think you are losing your property. So a subconscious, unconscious part of you doesn't want to get well. You are very happy having a diagnosis and a label. And you see people who talk to each other, my diabetes is worse than yours. As if you have got some Nobel Prize for it. I have more. Your back pain, you cannot go to work for 1 week. For last month, I haven't gone to work because of my back pain. So I am better than you. Either the one or the we want first prize, second prize. See, this is the problem with illness. Illness is all about identification. I am ill. I am diabetic. I am cancer patient. I am, which is the biggest avidya according to Maharishi Patanjali. He says, where is the whole problem? Tasya hetur avidya. And the ajnanatada ellame aamidu. You have forgotten who you are, so you think you are a diabetic patient. You have forgotten who you are, you think you are a hypertensive patient. And because of that identification, you are not allowing yourself to heal. Now, I am not worried about cure. Cure is a medical terminology. You have appendicitis, I cut out your appendix, I have cured you. You have a tumor, I cut out your tumor, I have cured you. That is the modern medical approach. Indian knowledge system, what does it say? Focus on healing the individual. Healing is different than curing. Curing is only this much. Healing is this. For example, what happens is a patient who has cancer, has gone for treatment, has had surgery, has had radiotherapy, chemotherapy, and the doctor says, you are cured. Now you know the patient is not yet healed. Because to become healed is to become the whole person once again, to become like you were before you had the diagnosis. We are not going to that. And that is where the whole focus of yoga as a therapy, Yoga Chikitsa, is not to replace allopathy, is not to replace any pathy, including Ganapati and Ganapati. We are not a pathy. We are a healing system. We are not a curing system. And that is why yoga says, focus on healing the individual who has the disease. Don't worry about curing the disease the person has. And you know what? Modern medicine, the father of modern medicine was William Osler. And what did William Osler say? The good physician treats the disease. The great physician treats the person who has the disease. Modern medicine has even forgotten its own father. That is the state we are into. Let us not do that with yoga. So, illness is an identification. When you stop identifying with yourself as a disease, you are disengaging. And that is what the Bhagavad Gita says. Always we say yoga is union, Vethathri, yoga unites body, mind, emotions, paisa, vasul, everything. it unites everything. We are always looking at unity. Bhagavad Gita gives a definition of yoga that says yoga is viyogam. Yoga is disentanglement from your union with disease. Dukkha, samyoga, viyogam, yoga sanghinam. We are always going to dukkha samyoga, that is my diabetes, my hypertension. I am diabetic is a dukkha samyoga. You have to move from dukkha samyoga by practicing viyoga. I am not the disease. The disease is an unwelcome visitor who I have to get out of my house at the earliest. தேவையில்லாத சொந்தக்கார படம் விருந்தாளி வரும் சொந்தக்காரு அதுதான் வியாதி. The moment it comes in the door, you get it out. But what do? We let it come in the door, we let it come and occupy us, remodel. We say there are 4 stages of disease: psychic, psychosomatic, somatic and organic. Psychic stage is where you are just not feeling well. I don't feel like myself today. That is psychic stage. Yoga can completely help the person at that point. Second, psychosomatic. Because of the stress, because of the agitation, because of the irritability, your blood pressure has gone up, your blood sugar has gone up, your muscles have got tight, your back has gone into spasm. It is temporary, psychosomatic. Now what happens? You rest a little bit. Somebody who you love comes and says, hello, you'll be okay. They pamper you for a few days. You get back to normal. Okay. Psychic, psychosomatic, yoga alone is enough. But then comes the next one, somatic. Now that process, that blood pressure which went up is now become